Thank you, Allison. A really inspiring way to think across such a diverse company and how the goals can be an area of a way to focus and organize. We'll hear another one of those examples from another Allison. This is Allison Goldberg from InBev is going to talk about a significant effort inside the company to look at the goals in a very comprehensive way through all the business units and then partner across a number of different stakeholders. So Allison.
Great. Hi, everyone. So as Kate just said, I'm from Anheuser-Busch InBev, which is the world's largest brewer. I'm one of 155,000 or so employees across 25 markets, and we produce over 200 brands. And if you're paying attention to the news as of late, there's a potential in the fall that we're going to be the world's largest brewer with a truly global footprint, including now both Africa and Australia, which is incredibly exciting for the initiatives that I'm going to be talking about and the potential of our company to make even a bigger impact and on the SDGs and other kinds of global targets. So I wanted to take a step back because this was obviously all framed around the Sustainable Development Goals and look at the definition of health and well-being. And of course, the U.S. Institute of Medicine's reflection on what, as a society, we could collectively do as a people to make people healthier. Because our approach as a company has been, let's reflect on these targets and look at what we can do to contribute to advancing the global health agenda. And of course, setting that aside to explore what we as a company can do to bring that to the core so that we meet both the social impact and social objective, but also bring this to the core as a business objective. And so we reflected on a range of existing targets and reports, obviously the Sustainable Development Goals, which is going to be the primary focus here, but also reports related to the harmful use of alcohol and what that means that have been developed by the World Health Organization, what the OECD is saying around incisive private sector action and all of the above. And of course, I'm going to be focusing on the SDGs, but we reflected on all of these agendas to really kind of figure out what is the best way for us to move forward and to position these really, we think transformative initiatives in our company to optimize impact. So goal number 3, obviously we've talked about health, which of course will have a mutually reinforcing impact on the rest of the goals. And I just pulled out 2 of the targets that I thought really were reflective of what our company is going to be advancing and have been advancing over the last few years. The first target, the ambitious goal that was set out by the WHO and also the UN to have the number of global deaths and injuries from road traffic accidents. Exciting to see this is now part of the SDGs. And as David Nabarro had mentioned that the alcohol industry is now a part of this work, I'd like to think that he was referring to some of the work that we're doing as a company and a broader coalition of companies to address this issue. So in 2014, our company had spearheaded with AIG and AT&T, who are part of this larger governance structure, and now Republic, the waste management company, the private sector coalition Together for Safer Roads. And it was actually launched at the UN with Amina Mohammed, who was obviously the force behind the Millennium Development Goals. And today we have 15 member companies who are part of this initiative, including some of you in the room, my friend Dale from UPS here. His company is a part of this coalition. And we are advancing a range of activities that we're very proud of over just the last 2 years. We're advised, for example, by an independent expert panel that is led by Dr. Kenmore Tsugu, who is a former U.S. Surgeon General, who has provided guidance on what a coalition of private sector companies can do to fill a gap to address the road safety challenges. And we've taken that guidance and counsel very seriously over the last year to define a set of initiatives that we could advance. I'm going to talk a little bit about 1 or 2 of those. One of the key areas that we've committed to as a set of companies is to addressing these challenges very locally. The area of road safety is incredibly complex and multifaceted, just as many other global health challenges or development challenges that we might face. And so what we've done is IBM is one of our partners, has taken their framework around the Smarter Cities Challenge and have adapted it so that it's relevant for a group of companies to actually make a meaningful difference, to work together to address a strategic road safety challenge in a place. And just last year, we've launched partnerships with 2 governments, one with Shanghai, the other with Rio de Janeiro, and I'm proud to say that you'll be hopefully hearing about this soon, that we're now have just signed a memorandum of understanding with the city of Atlanta. And we're exploring ways that we can help fill their road safety challenges by, for example, using our capacity across companies to do integrated data management, to using our strength and capacity around behavior change communications. As the company I sit in obviously has huge marketing capabilities. How can we leverage that to help these cities address these specific challenges? So that's the model that we're advancing. The other way that we're addressing road safety challenges is through a major initiative that our company has independently announced in December last year, a $1 billion commitment over the next 10 years to reduce harmful alcohol use globally. I'll go through some of these other goals later, but one of the key goals that I wanted to highlight that relates to addressing this road safety specific SDG is in the multi-year pilots that we've committed to. So we've committed to, as a company, to reduce harmful alcohol use by 10% across 6 cities over the next 10 years. And as part of that, we are using a generally broad framework which encompasses addressing harmful alcohol use, which incorporates underage drinking, binge drinking, and drink driving. So that's obviously the core of how it relates to reducing road traffic crashes in key localities. Understanding that this issue is not mutually exclusive and, of course, is intersecting with other related health challenges, violence, fetal alcohol syndrome, and others that a city might want to address. And I'll talk a little bit more about that later. But again, drink driving is a huge focus area of our company's commitment, both through Together for Safer Roads and independently through the Global Smart Drinking Goals that we've advanced and announced in December this year. So the second target in health that wanted, and Catherine had mentioned, is our strengthening the prevention and treatment of substance abuse, and specifically the harmful use of alcohol. So obviously the 4 goals that I had put up there address this in totality, but in a very specific way through our pilot initiative, we are going to be committing to supporting a range of comprehensive community-based initiatives, both from a social norms perspective and a clinical perspective in the localities that we work. So one of those that we're going to be supporting, and we're moving fast forward with this, is working with experts to develop and support the implementation of primary health care toolkits to implement screening and brief intervention at scale in health facilities across in the cities that we're going to be working in. It's one of the guidance that we've gotten from technical experts from NIAAA and other agencies around the world is that this is one of the most effective ways from a prevention perspective to address harmful alcohol use. So we've committed as a company in our kind of comprehensive package or toolkit that we're going to be advancing and supporting the advancement of to support screening and brief intervention. So the Sustainable Development Goals, number 17, we've talked a lot about today. Obviously, public-private partnership is a critical, aspect of all what we're trying to accomplish. And what we've been trying to figure out as a company is, well, how do we do that? How do we do that well by ensuring that we're getting the best technical, expert, and engagement across sectors, but also ensuring that the advice and counsel and guidance that we get to implement and monitor and evaluate this work is unbiased and independent. And so this is our framework. Yes, it looks complex because it is complex, but we've spent a lot of time this year since we launched to make sure that we develop an architecture and a model that can sustain over the next 10 years and hopefully can be a proof point for best practice moving forward. So at the top, you'll see a technical advisory group. This technical advisory group is going to be, and actually we've already started to convene and will be public about who's on this technical advisory group later this year, of independent experts across the alcohol and policy and research spaces to advise us on the design and oversight and implementation of these goals. And then, of course, we'll have a partners task force, which will include those institutions who are responsible for working to actually implement this work. And then, of course, we'll have, the role of what's going on locally. And you'll see what's really important here is that we have an indication of firewalls around some of these relationships. Because what we want to make sure happens is that the Council of Technical Guidance is the best and of the brightest and is unbiased. But of course that we have a role in implementing, and that those other partners who are implementing in the best way that they can. I'm going to skip through this for the sake of time. So where are we going to be working? So to date, out of the 6 cities, we have 3 selected. We have a memorandum of understanding signed with Brasilia, Brazil, Zacatecas, Mexico, and Leuven, Belgium. We are exploring where we're going to be working in Southeast Asia. It's most likely going to be China and potentially South Korea. In the US, we're exploring whether we're going to work in either Tulsa, Oklahoma, or Columbus, Ohio. And then, of course, we're exploring in Latin America South whether we'll be doing something in Argentina or Bolivia. And so our technical advisory group is working on helping us formulate the best city selection process with the understanding that there has to be strong political will where we work in order for this effort to work over the long term. So as I mentioned, lots of interventions are going to be advanced as part of this. FSG conducted research for us a few months ago about what our company specifically as one of the implementing partners could do locally to address this challenge. This is just an example of a framework of some of what we're going to be doing. As you'll see, what we plan to do cross-cuts both programmatic work as well as our commitment to what we're going to be doing differently in some of our marketing practices by investing seriously in social norms marketing campaigns, putting guidance labels on all of our products across, on every single one of our products by 2020, which is a huge contribution, and hope that that will obviously build knowledge about what's in the bottle and hopefully translate into some behavior change, which is the very complicated part. And then also committing to a shift in our portfolio. So we have committed to shifting our portfolio so that 20% of it is represented by no and low alcohol beer products, which is not easy for a company, for all of those that come from the private sector to do. And when we announced these goals, we said that at this stage, it's much less than 10% at this stage. So getting from 10% to 20% is a big leap forward, and we obviously need huge support within the company across functions to achieve these ambitious goals. But in addition to these evidence-based initiatives, we're obviously very committed to thinking about innovations that we can support. So as we talked a lot about in the closed session yesterday, we want to think transformatively. We want to see how we can position ourselves as a private sector model that can do something differently across sectors, but also think creatively about the kinds of innovations that we can test in some of these cities so that we can support in a new evidence base about what has promise in actually meeting this social and health objective. So as I mentioned, we have 3 cities selected. One of them, I just wanted to share, we have launched an official partnership in Zacatecas, Mexico, a very unique city. We wanted to make sure that we have a range of cities that are very diverse so that we can take those learnings and they can inform each other and then inform other cities around the world, because obviously they're all quite different. And so that was quite successful. We had both national and local government support in this commitment to reduce harmful alcohol use. And then if I can, we have a short video, it's 1 minute. As I mentioned, we'll find out at the end of this year if this transaction with SAB Miller takes place. But as part of that planning process, we have facilitated a formal relationship with the city of Johannesburg and the mayor's office to take these global smart drinking goals and put them into practice there. And so this is a clip of that partnership and the signing of that agreement with the executive mayor and our company that happened just last week. Oh, it's kind of like, yeah.
This week, the city of Johannesburg and Anheuser-Busch InBev announced a multi-million rand partnership. AB InBev, the world's leading brewery, has committed an initial 50 million rand over 5 years, designed to boost enterprise development and implement an effective alcohol abuse outreach program.
The important thing about this partnership is that it's looking at two critical programs. The first looks at the harmful effects of alcohol abuse and the reduction of harmful effects of alcohol abuse and responsible drinking approaches, which is a program that AB InBev approached the city of Johannesburg about and identifying Johannesburg as a critical site to initiate an international program on reducing the harmful effects of alcohol abuse. And this would include looking at impact of accidents, non-communicable diseases, and those sort of programs that would be implementing jointly with AB InBev, including creating literacy, knowledge and awareness of the harmful effects of alcohol abuse, symptoms that people need to be aware of and how to mitigate and deal with those. The second leg of the program is about enterprise development and job creation opportunities. And in many ways, the first part links the two because it's about the development of frontline officers that would be in communities doing the work, mobilizing people, creating awareness, using our digital platforms to create awareness and knowledge. This is about 6,000 young people in particular that would be deploying jointly with AB InBev. But the second level is identifying opportunities along the value chain for enterprise development opportunities and commercial opportunities for local people in Johannesburg.
At AB InBev, we've set forward some global smart drinking goals, some of which you see right here, where we believe we can move beyond responsible drinking to smart drinking. And in doing that, one of the most important areas of affecting people's lives is the cities in which they live. So we've been establishing a harm reduction framework and thinking of how we can work best in partnership with appropriate people in cities and communities around the world. And as such, Johannesburg, in the interest of the mayor as well as the people here of leading healthier, longer, happier lives, has come into our interaction, and hence the discussion of this project for harm reduction on alcohol.
Great. So, just kind of a flavor for what we're trying to move forward in some of these cities to make a difference. I know I have to close. I think I had like 30 seconds. But just quickly, I was asked to talk about some of the opportunities and challenges for doing this work. And I wanted to be very kind of transparent about what those are because this is very ambitious. And it's, we obviously are taking this very seriously to make sure that, we do this right from the onset, since it is such a big financial as well as meaningful commitment in terms of its social impact, but also something very unique for our company to do. And the one thing that I think that this can help us to accomplish is, we're hoping that we're going to be a global champion on reducing harmful alcohol use. There isn't a private sector actor that we're aware of, and definitely not in our industry to date, who's taking the charge, and we hope to set an example for others in our industry to do the same. We obviously want to contribute meaningfully to global targets and public health goals through rigorous monitoring and evaluation, as well as innovative monitoring and evaluation, and are looking forward to the opportunity to do that. But there are many challenges we have to overcome. We need to get the best players who are willing to work with us, both at arm's length and as well as together to address these challenges. And we need to make sure the monitoring and evaluation is really robust, but also practical and adaptive, because there's going to be a lot of interventions that are going to be implemented both within our company and outside of our company that we're going to have to understand and assess to ensure its impact, and both on the SDGs, but also for the core of our company. So I'll leave you with that, and looking forward to the Q&A.